Hello everybody and welcome to this month's video message. I'm at Ashford this morning to find out about cancer services. We provide a lot of cancer services to our patients in a variety of ways. I thought it'd be great for us all to meet the team and hear about the fantastic work they're doing in supporting all of us to improve the care for our cancer patients. So I'm joined by Sarah Burton, the Trust's lead cancer clinician and lead for palliative care. Morning, Sarah.
Morning, Suzanne.
What's our vision? What's your vision, Sarah, for cancer care at Ashford St Peters?
Well, I think much work has been done on prevention, but I think for us as a trust, our challenges are going to be around earlier diagnosis and enabling GPs and patients to access diagnostics more readily, more easily.
Yeah.
I think the other challenge for us is around patients living with and beyond cancer. We know there's over 2 million people living in this country as survivors with cancer, which is fantastic, and that's around the fantastic treatments that we are now able to offer. We need to look at how we can support that group of patients so they can live well for as long as possible. And that's about looking at not just their treatments, but the longer term effects of that around the benefits of healthy eating, the benefits of exercise, and supporting people in ways around how they might get back to work again and resume a normal life.
So Faith, tell me, what's an acute oncology service?
Well, the acute oncology service was set up about 3 years ago, and it was to tackle patients that come in with cancer as an acute emergency admission.
Do you see the benefits? Do we know that the care that our patients are getting is better?
It's good. The patient's relief on their face. You're a cancer specialist. Their fears are taken. They know that patients come into A&E. They know that there have been hundreds of other patients, but to them, they know how serious it can be when they're ill.
Very frightening, I would
So we have access to their information. We go down prepared, so we feel that they're confident when they see us.
Yeah.
And they are supported throughout the hospital. If they belong to other tumour groups, I will contact the relevant CNS. They will also see the patient on the ward, so they see someone familiar. But we do build up a rapport, and I must admit, the medics and the surgeons have all embraced the AOS. They do see the benefits that these patients need.
One of the things that's sort of debated quite a bit is the experience of patients that they have. And of course, every year we have the opportunity to participate in a cancer experience survey, and we've not always done brilliantly in terms of how we benchmark. So as I understand it, you're doing something innovative around this. Talk to me about that.
The concept behind it is simple. So year on year we have these experience surveys, and we find that despite providing a high level of quality to patients, we are often ranked slightly low on the experience. And I was talking to Heather Cordell, chief nurse, last year, and she suggested to me, this is what I'm looking for, experience-based co-design. So we looked at the model, and what it essentially means is that you're talking to patients and staff and capturing those little experiences that often confounds the overall experience.
Being able to diagnose and treat, in this case mostly ladies with breast cancer, is reward in itself, and I think everybody should and does strive to do the best job possible.
They became like friends, and I could ask them anything if I was in doubt about anything, either when I was in the unit or when I was at home. I knew that I could phone up at any time and ask them anything.
I needed somebody there to talk to explain how I actually was going to feel. Somebody, almost a buddy system of speaking to somebody that has had that sort of treatment to understand what you're going through.
It's been an enlightening project actually, and I've been so privileged to listen to brilliant stories that patients have. My feeling personally is that although we are providing a great service from the breast department, it is those little things, important things, that actually doesn't allow our experience ratings to go. Yeah.
So there you have it. What a fantastic time we've had meeting the cancer team and hearing about the fantastic work they're doing. I was particularly struck around the work that Mr. Qatari's been leading on experience-based co-design. Now, this is a methodology, as you heard, that aims to hear from patients about their experience and then work with the clinical team to make targeted improvements. Now, I think it's a great methodology for doing that. And please, if you're interested in using a methodology like that to improve your patient's experience, let us know and we can do things to help access the expertise so that we can keep working on improving the experience for all the patients in our hospital. So thanks to the team here at Ashford. See you next time.